First of all, for those of you who are in fact here, thank you for coming back. It was pretty fabulous outside. I think we can all agree with that. This afternoon is our endocrinology module, and again, my distinct pleasure to introduce our next speaker. Dr. Thompson, just a go-to person in endocrinology and diabetes, and she spoke to this topic and no one could get enough of her. So we asked her to please come back, and she did again today, and she actually has 2 talks, and her first talk will be just a nuts and bolts diabetes update. Please help me welcome Dr. Thompson.
All right, well, thank you so much for having me come to speak today. I'm really excited to talk to you guys about a diabetes update, specifically about a lot of the new drugs that we're seeing out now for type 2 diabetes. So the objectives, we're going to talk a little bit about diagnosis and classifying diabetes. We're going to summarize our glycemic targets, where we want to be, and then we're going to talk about drugs that we can use to manage type 2 diabetes. We're going to talk about how effective they are and what else we can hope to gain from those drugs. So nowadays we got to think about what else they can do for us. So cardiovascular benefits, renal benefits, and then we're going to do some examples of patients and figuring out how to use these drugs in a stepwise approach. So, I bring these up because in your spare time, which I'm sure you don't have, these are really good resources. So this is kind of what we use. These come out every year. On your left is our ACE guidelines for diabetes management. They give this really nice diabetes algorithm, and I'm going to show some of those slides in my talk today, but those are nice slides for you guys to keep in the office. So look at those to kind of help you guide drug therapy. And then the right side is the ADA Standards of Medical Care, which I'm sure you're all familiar with. They put out an abridged edition for primary care doctors every year, and that can be really helpful, especially when we're talking about changes in therapy, which occur every year. So looking at that can be helpful as well. I bring these up because I know you know this, but we take care of very few diabetics, actually. About 5% of diabetics are seen by us, and everyone else is seen by primary care doctors. So you guys are definitely, managing the bulk of this. Okay, so why this topic is important, you can see very easily. Numbers of patients with diabetes is increasing. If we look at this, it's pretty startling. By 2050, we're saying that about 1/3 of U.S. residents are going to have diabetes. And if we think about women,